Perfect. Well, hello everyone. Welcome to the 25th annual meeting of the Washington Group on Disability Statistics. I just want to inform the attendees that there is interpretation available from and into Arabic, French, and Spanish. You will see the instructions on the screen on how to use this feature. You will have an interpretation globe icon if you're joining from your laptop in the toolbar. And if you're joining using your phone, you will find it in the three dots that say more. And this meeting is being recorded. Please allow a few seconds if you're using your microphone actively, and bear in mind the pace when speaking for the interpretation. Thank you.
Hey. So on behalf of the Washington Group and its partners and members and friends, I'm Jennifer Madden, I'm the chair, and I want to welcome you to this 25th annual meeting of the Washington Group on Disability Statistics. As our friend and colleague Tim has said, we are having interpretation in Spanish, Arabic, and French. You can select the language of your choice in that little icon. And they'll be in these instructions will also be in the chat if you need them. And captioning is also available. And I want to thank Kalama Events for all of the help they have had. They've given us in the past, but also for this particular meeting where we've needed a lot of help. So thank you very much. Some housekeeping items quickly. Please introduce yourself in the chat so we can keep track of everyone who's attended, and we can send you the materials afterwards. Your name, your organization, your country. Again, please mute your mic when you're not speaking. And again, for the interpreters, please speak slowly so it makes their life a little bit easier. And feel free to make use of the chat box. We appreciate and invite questions and discussion, and it's particularly important for this meeting to use the chat because of the very tight schedule we're on. So I apologize for that in advance. I wish there could be more interaction at this meeting, but for a variety of factors, that just wasn't possible. And again, the meeting is being recorded. Again, the support for the interpretation into the three languages has been provided by the Federal Ministry for Economic Cooperation and Development, the German Development Corporation, as part of another grant that we have with them, and all the work is being done by Kalama Events. I want to thank Tam and Beline for their help, and as well as all of the interpreters that are working with us today. As always, it takes a village to create even a 2-hour meeting. So the folks that supported the meeting development were the Washington Group Secretariat, the Washington Group Steering Committee, and a subset of that steering committee that comprised a planning committee, which was the Secretariat, and Elena from ISTAT, and Riaza from the Maldives. And thank you very much for your time on that. Of course, want to thank moderator, me, and the presenters and the participants. And of course, thank you all for your contributions for being here. It would not be a meeting without you. Let me quickly go through the objectives of this meeting. And the objectives are very similar to every other meeting that we have had. And again, this is our 25th. During this meeting, we're supposed to share our accomplishments since our last meeting, which was Washington Group 24. We want to hear from our regional disability statistics groups about their activities and plans, and also from our work groups, including the release of any new disability tools. We want to hear about disability data-related work from our members and partners. And most important, we want to present and then agree upon the work plan for the year to come. So the goal here, in addition to information sharing, is to determine next year's work plan and activities. And we need you to contribute to that decision-making through the discussions in the chat, but also in any follow-up email communications that we will have. So the agenda for this meeting will very quickly move into the Secretariat updates, and then very quickly into an update on our major activity over the past several years, which has been the country disability reports. We'll then talk about the release of a new tool, the Child Functioning Module, humanitarian version that was developed with UNICEF. And then we'll have presentations on the Global Disability Summit from two perspectives, from two of our partners, one about a data forum and the other about the report that was released. We'll then get an update from the Mental Health and Psychosocial Functioning Working Group, and then from the Disability Regional Statistic Group chairs. And then we'll talk about next steps and closing. So moving directly to the Secretariat's update. So here we are, our 25th meeting. Remember, we started back in an in-person meeting in February of 2002 in Washington, D.C., and 25 meetings later, here we are. This is our 6th virtual meeting. This is not by preference, obviously. COVID came in there, made our life a little more difficult, and also funding has become an issue. So we have not been able to have an in-person meeting since the 19th meeting in Argentina in 2019. Of course, it's everyone's preference to have an in-person meeting, and hopefully we can do so in the future, but that hasn't been happening. And any ideas about how to make that happen will be very greatly appreciated. We also are all having a very abbreviated meeting this year. It's only 2 hours rather than 6 or 7 hours that we would have over 3 days. That's for a variety of reasons, some due to funding, but also the Secretariat has been operating on some constraints in the past months, making it very difficult for us to do a major meeting. And as you know, the U.S. government is still closed, and so the Secretariat is not able to participate as they would like. We may be able to do more in the spring. Maybe we can do another meeting. Or another idea we had was to pick selected sessions from this very quick meeting and then have webinars devoted to them throughout the year. And we can come back to that at the end. But think about it as we go through the sessions. Is this one that we're only giving you 10 or 15 minutes on? Is this something that you would like to have an hour webinar on? And we can do that to keep in contact over the year and see what we can do for the 26th meeting and perhaps something interim. We'll see. So for the one thing about all the work we've done over the 25 years is the Washington membership is still quite widespread and still covers most of the world. And it's nice to see that we've been able to maintain that interest from many, many, many different countries. And this slide just shows you just a picture of where the Washington membership comes from. Our primary purpose since day one was to develop valid, reliable, and cross-nationally comparable data on disability, and also develop methods to improve statistics on persons with disabilities. And we primarily did that by creating data collection tools and a whole bunch of documents and guidances that go with those tools. So we have the short set enhanced, the extended set, the child functioning module, the child functioning module teacher version, now the humanitarian version, an inclusive education module, and a labor force module. So over 25 years, we've done a lot of work in creating data collection tools that are in a great deal of use. And I think that we don't want to go, I'm not going to spend time on these slides, but just to give you an idea that since our last meeting, just in the last year, these slides show selected reports that have used the tools. Now, I will tell you that the Secretariat does not spend time looking for reports. These are things we either come across or people send us. So we know there's many more, and this is just a selected view of tools used. And this is particularly on this slide, the tools used about children. And obviously our partner in UNICEF, they do a lot of publications using the child functioning module. Another part of the work, particularly of the Secretariat, is to provide technical assistance and interactions among members. One of our key mandates was promotion and coordination of cooperation in this area, and the Secretariat and individual members have continued to interact with national statistical offices, other UN agencies, multilateral organizations, OPDs, development organizations, academia, and of course our regional groups. Just an example, since our last meeting last year, there's just a listing here of UN agencies and organizations that we've had some interaction with. This slide shows a listing of some NSOs that we've had interactions with, more NSOs. Again, that makes a lot of sense. Our primary membership are NSOs. And then here's just a listing of other entities. Some of these are bigger collaborations, take longer. Some of them are just answering questions and often just telling people where on the website they can find the information that they're asking for. We still get a lot of requests for information on translation. I think it's interesting. There's obviously people still wanting to use the tools that haven't used them. So on this slide, you just see a list of where we've gotten requests from the organization and the languages. You remember a couple of years ago, we adopted a new procedure for making translations available. Unfortunately, we haven't been able to move on that. Again, there was an issue of just having the time and people to work on this without any funding. So we still would like to do it. We still think we should move forward with it. It would make the tools and the translations we have much more available, and also have that metadata about them that will help people out. So this is still something we'd like to do, and unfortunately we just haven't been able to do it. So we'll probably be back in touch on this. We were very lucky to get some financial support for 2 of the regional groups. Excuse me, many regional groups that are operating, but only 2 have support that comes through the Washington group. Others have support from other mechanisms. That support is from, again, the Federal Ministry of Economic Cooperation and Development. They support the 2 regional groups in Africa, the Brazzaville group and the Southern and Eastern Africa group. As has been the case of before, that funding that's come, that is administered by University College London for us. There were actually 3 grants starting in January 2021. And the 3rd one you see is ending in November 2025. And that the nice thing about these kinds of grants for supporting the regional groups that come to the Washington group is that we can also use some funding for broader activities, such as the interpretation at this meeting, but also keeping up the website, doing things on the website, because it's a form that the regional groups use for collaboration and cooperation. Unfortunately, we have not been approached by any other funders to continue this work. If anyone knows anyone, let us know. We are aware of some activities going on with partners. I'll mention that at the end, to get funding to support disability statistics, and Washington Group may be involved, but it's not the same kind of support that we've had before that provides some institutional report and also direct support for the regional groups. So I'm going to stop here. If you have questions, put them in the chat. I don't want to open the floor right now for time reasons, because I know we're probably already past time. But I'm going to move very quickly to session 2, which is on the country disability reports. Now, after we spent all of that time creating tools and documents to support those tools, at our meeting in Argentina in 2019, we decided we needed to spend more effort, more time on other aspects of our mandate, particularly on analysis and dissemination. It's very interesting to collect data, but we also want to disseminate it. And because we are an international group, we wanted to enhance dissemination in a way that facilitated comparison across countries. Many countries, as we saw, many organizations were analyzing the data and disseminating it, but they were in their own country reports. We wanted to find a way to bring our members together, create comparable reports that we could put out as a Washington Group project. Since the data most widely used, the data set most widely used was the short set, we decided to focus on the short set. And the agreement at that meeting was to have a product, which was a report that as many countries as could would produce, and that we would place on the Washington Group website. We wanted the reports to be short, as we know this is added work for everyone. It's not part of your day-to-day responsibilities. We wanted to use standard language, wanted to use standard figures, and we also wanted to give countries the flexibility to add what they wanted to make the report of more interest to them, but keep that main structure so that they would be similar across. And so we had created a format, a template, some standard language, standard figure designs. Again, the idea was that they should be country specific, done by countries, not by a third party, but that they should be similar enough that it would be easy for a reader to go from one report to the next. Once we agreed on that and the template, it became clear that to make this activity work, we'd also have to create a bunch of products that would facilitate the development of the reports in this standard format. So the Secretariat created a whole bunch of guidance documents, syntaxes for creating the indicators, worksheets, and FAQs, all supported the production of the reports. And if you recall, we also had a subgroup that investigated the question of whether for this activity, the estimate should be age adjusted. We had a group of people working on that, most notably our colleagues from Mexico and from New Zealand, who did some analyses showing differences and created a document that discussed how to do the age adjustment, how we would do it, pros and cons of doing it, and then came up with a recommendation that, yeah, in fact, the estimate should be age adjusted using a particular standard and designated age groupings. We created a report of that, which is on the website. And it was those guidance documents and the age adjustment documents that were used for countries to develop their reports. The Secretariat provided as much technical assistance as requested and we could cover. We had one-on-one meetings with countries. We did a lot of email correspondence. We also hosted a bunch of webinars on creating the country report, which you can go look at. And also question and answers. We had a webinar where we just said, well, we'll be online. You come and ask us questions about how to do it. And then the other resources for assistance were the regional disability groups, which we worked with, and also our colleague Dan Mont at the Center for Inclusive Policy, who responded to a lot of questions and provided as much technical assistance as needed. It was a very interesting challenge. I think when we started, we didn't realize that this was be a little bit more complicated than we thought it might be. And once we do the template, we're done. But it was an interesting experience. It was interesting to learn about the challenges. One, and I think this is just showing my background and where I come from, many national statistical offices do not age adjust their published data. In the US, we age adjust a lot, particularly in the health area where I came from. So it was new for me to see that things were not being age adjusted, that was not standard practice. It makes perfect sense when you're just dealing with one country and you're not doing comparisons. So you want the crude data because that's the real number. But since we were wanting to make these comparisons and we investigated and decided to age adjust. So that was a challenge. Equally interesting was that there was less consistency across countries in how standard indicators are defined than we anticipated. In a lot of the subject matter areas, there are a lot of standardized indicators in education and employment, for example. And so we thought there'd be a lot of much more standardization across countries. And we found that there wasn't quite as much standardization as we thought. So we had to kind of tweak that. We had to allow for different countries to use somewhat different indicators, which is a challenge for comparability, but that's what the data showed. I think reflecting how disability statistics are handled in different countries, not all the measures that we wanted, the outcome measures, were available from a single data source in all the countries. And often the person developing the table, the report, did not have access to these other data. So it made it much more complicated for them to create the report. We had our own formatting challenges in terms of how to set up the title page and in how to incorporate what countries wanted to include in the report. We had tried to use some of the funding we had available to get an expert contractor to do the formatting. Surprisingly, we couldn't find anyone to do the formatting. Every company we approached and tried out did a worse job than our great people at NCHS could do. So we had to move to do all the formatting in-house, and it was just a bit more time constraint than anything. But it was surprising how hard it was going to be to get that done. And then finally, we needed to address possible confusion in what might happen because the estimates in the report, because they're using the standardized age adjustment and standardized format, might be different to what NSOs publish on their website. And we didn't want any confusion there. Now, if a third party is pulling data from multiple sources and analyzing it, whether it's, they're doing it themselves or the country is giving data to the UN to do, I think more of an expectation that those data might be somewhat different than a report that the country does itself. But because ours are country reports with the country name on them, there might be more of an expectation that those numbers would mirror official, quote unquote, numbers. And we didn't want to have that confusion. We didn't want to certainly put any of our members in an uncomfortable position of trying to explain why those numbers were different. So to address this, on the website, there are some notices for users. One is that the estimates in the reports may differ from related estimates that a country would put out or another government agency other than the statistical office. And why that is the case. The differences can arise because of several factors, different definitions of disability that are used actually in the country report than the one we were using, or reporting on different age groups, or using different terminology, or other changes that might have been introduced during the process of standardizing the text and the figures. In addition, the estimates are age adjusted using this 2020 world population as the standard. Again, allowing for the cross-country comparison. Any other standard, equally useful, will not be comparable. So the unadjusted estimates or any age-adjusted estimates from a different standard will differ from those in the report. This is on the website. It can be on the country report if you like it, and it depends on what the country wants, but we are at least trying to preempt any confusion that may come up where the report from country X says this % of the population has disability, but the website for that country has a different number, different definition, not age adjusted, etc. Hopefully this will work. I am very pleased to announce that the website where these reports are housed is now live. If you go to the Washington Group website, you'll see you can click on something called Country Reports where the little green arrow is on the slide. You will get to this landing page. It will say something about why we were doing it. And then you can hit the little arrow, and that will take you to a page which doesn't actually look like this slide, but will have a listing of all of the reports. Now, what is up there now? On this slide, you see the reports that either are finalized and on the website or are still sitting with the Secretariat for a variety of reasons. And if you go through this list, kind of starting with Brazil, goes down to the US, and on the other side through Niger, those are on the website. The French reports are the only ones on the website. The English versions of those French reports are not on the website yet, but they will be. They have been translated as there's a Portuguese report that's from Cabo Verde has also been translated. There's a link to the webpage in the chat if you want to go look. The reason that the other reports are not up yet is because once the government shut down, no more formatting was done, and we couldn't load anything else. But there are also some countries where we're still have questions to authors. We're waiting for responses so we can finalize the report. Hopefully, all of these reports will be up sooner rather than later. We will, as soon as government reopens, we'll start the final formatting on the ones that are finished, and hopefully get feedback from our colleagues where we're waiting for some kind of answer about some particular technical or some issue that we weren't clear about how they wanted us to answer. So thank you all who worked so hard on the reports and worked with us on the reports. We're very pleased with the reports that are up there. They look great, I think, but I guess I'm a little biased. And we really look forward to perhaps doing this again in the future now that we've actually learned how to do it. For those of you who have not done a report, there's still the opportunity. We're still working on them. If you go on the chat, if you haven't done one and you want to do one and you intend to do one, just let us know who you are. Give us your name, your email, your organization so we can contact you, and whether or not you want us to resend the guidance documents. We're still open for technical assistance, for talking you through it. Oh, there's a lot of documentation there that you can use to develop the report. It should be relatively easy as we go and develop better and better guidance. So please, if you're interested at all, it would be great. I think we have 29 reports. Be wonderful to get another 10, but maybe that's being overly optimistic, but we would like to get some more. And then of course we could always add to that library as time goes on. So I want to thank everybody, particularly the folks at NCHS, and Julie and Natalie and Nazik, who really figured out how to do this and make it look really, really nice. So that's kudos to them. And I'm sorry they're not here. They're not here to hear me say that. If you have one quick question, we're just a minute over, so why don't you either we have a question, Suzanne. If you want to come off, you can ask your question. Go off mute.
Did you say my name, Susanne?
Yeah.
Yeah, I was just wondering, I think a couple of years ago we talked about doing an aggregated or compilated report. Is that still on the table, or something you have concluded is too difficult due to all the reasons you mentioned earlier?
Right now everything seems too complicated because of the situation. We weren't sure we were going to be able to pull this meeting off today. It'll be a miracle. I think that some of the regional groups are definitely interested in doing that. I think once we finish this round and we see how the how the reports we look at them in total. We really haven't had a chance to do that. Where there might be enough to pull together, I think there's still interest in doing that. I think the question is, given the subset of reports we have, does it make sense? I think it will. There are some of the standard figures that are pretty much in every report, and I think we could pull together. Many aren't, so they would be on the wayside. So definitely first saying, do we want to do regional, and then do we want to do something joint? And I think with 29 reports, that's a reasonable number to pull together. It's not too small. If we could get another 5 or 6, and if you looked at the distribution of countries from maybe other areas, that would be nice. It's not it's not a broad representation, so we could still work on that. That's the kind of thing, though, I would feel more comfortable hearing from you, the members, that this is something you want us to pursue. If it's something you think worthwhile and something we would need some help on it too. We'd need like feedback and things like that. So that's a good thing to let us know, especially all the countries that submitted reports. Do you think that might be useful? Okay. Claudia, are you on? Okay. I don't think something must have come up and Claudia wasn't able to make the session today, so I'll go ahead and give her her talk. I was involved in developing this, as was the whole secretariat, so hopefully I can answer any questions you have. If not, we'll send them on to her. So we were very happy to work with UNICEF to create a humanitarian version of the child functioning module. We had gotten a lot of requests for this over the years, and me being the Washington Group Secretariat, and I know that UNICEF had a lot of requests for it as well. A lot of interest in this area. The problem is it's really challenging area. And so it took a couple of iterations to kind of think through how best to do this, but it is done, it is available, and it is on the website. So the objectives of the child functioning module and the objectives of the humanitarian version are exactly the same. Again, the primary purpose of all of these tools is to identify children with functional difficulties. And the questions all ask about difficulties the child might have in doing certain activities across a range of domains. Remember, there are a lot more domains in the child functioning module because the nature of functioning in children, how quickly it changes, and a variety of things we've talked about over the years. The questions are meant to be asked of the child's mother or primary caregiver. And we know that in places where this has not been done, where a different respondent has been used, the quality of the data has been in some cases quite low. So kind of one of the mantras that UNICEF and we have used is that if you can't talk to the primary caregiver, it's probably you need to question whether or not you really want to do this data collection. The standard child functioning modules is got 2 questionnaires, one that has 16 questions for younger children, 2 to 4, and another with 24 questions for children 5 to 17. When we were talking to people on the ground who work in humanitarian situations and want to collect data, we heard 2 conflicting things. They need a lot of data, but they don't have a lot of time. So there was a real push to reduce the data collection burden. And this makes perfect sense. These are very difficult situations where the primary purpose is to provide aid. So there is not a lot of burden to go around. There are other things going on, but one needed to reduce the burden in a way that was fit for purpose. What could we give up in terms of for example, the domains covered that wouldn't affect data quality for the uses that the people on the ground were going to use it for. What is most important to retain for the humanitarian response? And we also realized that the constraints related to data collection would change over time. Change, of course, according to kind of place and characteristics of the humanitarian challenge, but then also over time, you could collect different kinds of data. So the HV is similar to the regular CFM, contain information on functional domains to identify this population with children with disabilities. It does not provide direct information on the services needed by those children. That data also needs to be collected, but it does allow you to identify that population. And while reducing burden was an important criteria, it had to be with the realization that any reduction in the CFM itself would result in lost information on functioning, and the person doing this data collection needed to weigh the loss of the information versus the cost and logistic challenges of collecting the data in a particular humanitarian situation in a particular point in time. So I'm not going to go through these, but you can see the domains of the children 2 to 4 and 5 to 17 for the traditional CFM. And what the decision was for the humanitarian version, there would be a 2-tier approach. The first tier is a set of questions. It is the shortest set that we thought could be used at, for example, the onset of a situation when data challenges are the most severe and when priority for the data is related to the immediate and most critical humanitarian response. So this is something you would do generally at the beginning and collect data that would be used for the response, as opposed to getting background information on prevalence. There are 10 questions in Tier 1, and that was considered a lot for children 2 to 4 and for children 5 to 17 in 4 domains. But because there are skip patterns, only 7 questions are asked about any one child, not all 10. And the domains are seeing, hearing, mobility, walking, and fine motor skills, use of hands. Tier 2 could be used maybe later on when there are more resources, more time, and you could do more comprehensive data collection. In Tier 2, for children 2 to 4, there are 12 questions over 6 domains. Since there are skip patterns, child would probably get 9 questions. For the 5 to 17, there are 14 questions in 8 domains. And again, each child would only get 11 of those because of the skip patterns. So for 2 to 4, the domains are seeing, hearing, mobility, fine motor, communication, comprehension, and controlling behavior. And for 5 to 17, you still have seeing, hearing, mobility, fine motor, communication, and controlling behavior, but we add focusing, attention, and concentrating, and emotions and anxiety. And just to show there is an impact on prevalence, as we know, depending on the different versions that you're using. And this slide just gives you an example of that for some countries that are having humanitarian incidents. So, for example, in Afghanistan, for children 2 to 4, if you use Tier 1, you'll get a prevalence of 3.3. But if you did the standard CMF, which was done in that country, it goes up to 10.7. And in all cases, prevalence goes up from Tier 1 to the standard, and sometimes quite dramatically. So for like children 5 to 17 in Central African Republic, it goes from 2.7 to 31. So when using these data, it's very important to be clear which version of you're using of this data collection, whether it's Tier 1, Tier 2, or the full CFM, and make sure you're using the version that most corresponds to your needs for data. The CFM is on the website. Here are some publications on it. The link to these these documents is in the chat. The webpage for the CFM HV and these documents, as you can see on the screen. Okay, and on behalf of UNICEF and the Washington Group, thank you. If you have any questions about this CFM HV, please either put them in the chat, send them to me outside of this. I will make sure that Claudia gets them. We have a minute. If anybody has a question, I can try to answer it. Julie, is anything in the chat? Okay. Unless somebody wants to pipe up in the next couple seconds, I will move on to the next session. Trying to keep us on track time-wise. Thank you. Okay. Okay. Now, our next session is on the Global Disability Summit that was held in Berlin recently. And we thought there'd been a lot of interest among our members, steering committee meetings and past Washington Group meetings where we heard about the Disability Summit. And we thought it would be good to have a session where we had some of our colleagues who attended the summit and participated on behalf of the Washington Group. There were some Washington Group things there, but we asked two people to talk about two aspects of that summit. And I'm going to hand it over to Elizabeth Lockwood with CBM Global Disability Inclusion. She's representative to the UN, that's her title, to talk about the data forum. Elizabeth, are you there?
I'm here. Yes, thank
All
you. You can, yeah, great. You can go to the next slide.
Okay.
The Global Disability Summit, just as a quick background, this time it was the third summit focusing on inclusive international cooperation and national ownership around disability, of course, this time in Berlin from the 2nd to 3rd of April this year I can't believe it was this year. We were lucky enough to be part of a data forum on the second day, on the 3rd, 3 consecutive sessions for about 3 hours. And the Washington Group, of course, was part of this, as was my organization and International Disability Alliance. And the vision really was to have a dedicated theme forum on disability data. And it was the first time the GDS held a thematic forum like this. And it was very multi-stakeholder in nature. So we had government, statisticians, researchers, NGOs, and of course, persons with disabilities and their representative organizations. There is quite an interest in disability data, especially around building better data systems, inclusive data systems, using data, analyzing data, disseminating data. So this was a great opportunity to do this. Next slide, please. The organizers, as you can see here on the slide, it started with the World Bank, but then quickly expanded to many different partners. And of course, the Washington Group, you can see, the Global Disability Fund, also the Center for Inclusive Policy, Dan, who will speak next, is from there. Fordham University's Disability Data Initiative, International Disability Alliance, which was really important as the representative of organizations of persons with disabilities, Microsoft, UNICEF, and the organization I work for, CBM Global. And we prepared for a very long time prior, but it really came together nicely. And I'll speak a little bit on that in the next slides. Next slide, please. So we wanted to have different themes. And so we came up with 3 themes, which I'll talk about in a minute. But really ensuring that we had different perspectives highlighted on disability data, users, and of course, statisticians and governments. OPDs were strongly represented throughout, which I was very proud of. I think that was really important. And then, of course, we had commitments from governments to carry out or strengthen disability data in their countries, which is excellent. And I'll highlight that in a minute. Next slide, please. So the first session did highlight the Washington Group, and Steve was the presenter. He did a fantastic job. He is from the National Institute of Statistics in Brazzaville. He was fantastic. He really highlighted the work of the Washington Group. He got a lot of questions. Sorry, there is background noise. But we also learned about data led by organizations of persons with disabilities, deaf-led data, and also youth working on data. So this was the first session. It was a really nice way to kick it off, to really look at the diversity and different ways that data are being collected and being used. Next slide, please. The second session was on investments and partnerships. And I really found this powerful because in the panel, we had somebody, Lisa, from the Pacific Disability Forum and Elsie from Stats for Development Division in the Pacific Community. And they went back and forth talking about their very powerful partnership on data. And I found this great. It's such a great model we can replicate. That was very, very powerful. We also had the academic side coming from Sophie Mitra. I represented UNICEF. And then Charles, who's a UN resident coordinator in Ghana, was just phenomenal. Really interesting perspective. And again, of course, the OPD representation. And session 3 is the next slide, please. And this was a really great way to end because the government, 3 governments spoke on their commitments to data commitments. So we had Jordan, Kenya, and Malta that made commitments. Jordan was one of the co-sponsors of GDS, along with Germany and International Disability Alliance. The Malta example was, I'll talk about that one a little bit more. They committed to mapping disability data across different ministries and entities, identifying data gaps, including citizen-generated data, and creating common indicators aligned with international best practices, and creating a unified register alongside appropriate safeguards. They have used the Washington Group short set questions, and this is a really wonderful example of a country engaging and investing in disability data. So this is wonderful, and it was announced in this session. We also had Microsoft, great, World Bank, and they announced their Disability Data Hub, which is new, and then Gopal from UNICEF talking about the work they do. A fantastic panel as well. And that was the end of the 3 sessions. Next slide, please. Excuse me. The outcomes we're still working on some of the outcomes. We do need to have a follow-up, and that's something that we will be working on, how we can really build on these commitments that were made, what we discussed. There were excellent discussions, how we can take this forward, making sure that we have another forum in future Global Disability Summits. The next one will be, I believe, in Qatar. So how we can do this again, ensuring that more countries commit to data. And I wasn't able to add this to the slide, but there are 86 Global Disability Summit commitments on data, which is fantastic, and 16 Global Disability Summit commitments to the Washington, that include the Washington Group questions. So we see that this is a really important topic that needs to be funded more, highlighted more, carried out more. And I think it was a beautiful example of multi-stakeholder partnership and how we can work together to really strengthen data. And of course, the Washington Group is a very important partner in this. I was very happy to work with Washington Group and everybody else in this. And I will finish here, happy to answer any questions. Thank you.
Are there any questions for Elizabeth? Thank you so much, Elizabeth, for working on that forum. I know I was involved in some of the planning, and it was a huge planning effort. And I can honestly say that if you hadn't taken the role you took, I don't think there would have been a forum. So thank you very much for that. And thank you for sharing it. It was really nice to have the Washington Group represented, and I know Steve did a good job. So thank you. Any questions for Elizabeth? Okay. Then I am going to hand it over to Dan, this for the with the Center of Inclusive Policy and a long-term Washington Group member to talk about another aspect of the summit. Go ahead, Dan.
Hello, everyone. So, do I share my slides or are you going to?
I'm going to do it.
Hello,
Yeah.
everybody. Great to be with you virtually. I'm here to talk about the Global Disability Inclusion Report, which was done for the GDS. There's a QR code on the screen right there. If you scan that, it'll bring you to a link for the report. The idea behind the Global Disability Inclusion Report was not to replicate UNDESA's regular reports on sort of the state of people with disabilities around the world, but rather to try to put forth a road to inclusion. Okay, so what are the steps we need to take in order to get there? And it was done by many contributors. Next slide. So this report is several hundred pages long. I'm going to try to summarize it in 10 minutes. So I'm just really going to hopefully whet your appetite to read it. The first chapter talks about the diversity of persons with disabilities, tries to explain the great range and variety of people among people with disabilities, the context, the diversity of supports that are needed, gender, socioeconomic status. As you can see, there's over 300 references. So it's a very good summary of who we're talking about when we're talking about people with disabilities. The next slide. Chapter 2 looks at structural efforts to implement the Convention on the Rights of Persons with Disabilities. It talks about legal harmonization, how laws are changing and can be changed to be in line with the principles of the CRPD. It talks about the various models that countries use to try to implement the CRPD, whether those are special commissions, focal points within ministries. There's lots of different models of how countries try to do this, and the chapter reviews those. It talks about data, which I'll talk about a little bit more in the next slide. And it also goes into public spending, how much are countries actually spending on inclusion and how can we monitor that? Next slide. I'll slow down a little here because this is the Washington Group on Disability Data. The data section first recognizes the great progress that's been made in the inclusion of disability in quantitative data, and because of the work of this group to a huge extent. But it also talks about the difficulty with the lot of difficulty threshold, because in analysis, we find that people who have some difficulty, especially in multiple areas, also experience exclusion. And it talks about when we do our analysis of disability, to what extent should we be really looking at the full spectrum of difficulty that's captured by the Washington Group questions and not the single cutoff that is recommended for internationally comparable prevalence estimates. Another thing in the data section was that it noted that we need to collect more data on environmental barriers. It's one thing to document the prevalence of disability, the patterns of prevalence, and to disaggregate outcome indicators to show the gaps that people with disabilities experience. Another thing to collect the environmental data that can give us clues on how to address them. The chapter also talks about the need to improve administrative data systems and to harmonize all these data systems. We have the surveys, we have administrative data, and we need to be able to harmonize them to reduce confusion, but also to leverage the power of these data. By being able to combine different data sources, they become more powerful. It also talks about the need to use more citizen-generated data. What's the appropriate role for citizen-generated data, and how can it supplement, complement, augment the data that national statistical offices and line ministries are collecting? And finally, it points out the fact that while the collection of data has really risen, what hasn't risen as much is the analysis of the data. We need to analyze the data that we collect. And we also need to think about indicators beyond the standard indicators that really capture the experience of people with disabilities. So for example, of course, we want to look at the poverty gap between people with and without disabilities. But if we don't take into account the extra costs of living that people with disabilities incur, we're actually underestimating the poverty experienced by people with disabilities. And assistive technology, to what extent are people's needs for assistive technology met? There are a lot of important indicators that talk about the state of people with disabilities that are not included, say, in the SDGs, and we need to think more broadly about that. Okay, next slide. Chapter 3. In Chapter 3, we try to look at, identify big global trends that are impacting the lives of people with disabilities, that interact with disability. And they were technological change, things like AI, for example, urbanization and migration and displacement, which are really growing nowadays. Climate change, of course, is a huge issue. Humanitarian crises and emergencies, and evolving care and support economy. There's been a lot of attention lately on the care economy. And until recently, people have been focusing mostly on the providers of care, not the recipients of care and support. And so this chapter, I can't go into it. You can see there's over 600 references, really goes into the relationship, the interaction between disability and these global trends. And you have to go through the report to get more details. Chapter 4 tries to put forth what are some of the key accelerators for inclusion. And you can see here, it's participation enhancement, really trying to involve people with disabilities in the design, implementation, monitoring, evaluation of policy. Accessibility, of course, is key in all areas, not just physical accessibility, but informational accessibility. Combating stigma, care and support systems, as I was just talking about, and of course, affordable and available assistive technology. And see these some of the key drivers that need to be looked at. Next slide. Then we talked about, the chapter 5 talks about the financing. How are we going to actually finance this, and how do we analyze the financial systems that are supposedly promoting inclusion, domestic and international resources, what should be done with the spending? It shouldn't create new barriers. It shouldn't, for example, and then the twin track of spending. We want all infrastructure policies and programs to be inclusive. At the same time, we want more and better designed disability-specific programs. All of this has to include the meaningful participation of OPDs. Chapter 5 talks about this, and it also presents data on the extent to which these things are being financed. So the last slide, the next, just to sum up, the big recommendations from the report: harmonize laws and policies with the CRPD, strengthen those data systems like I was talking about, mainstream accessibility and inclusion, identify and address individual support needs. It's not enough to say, oh, if someone has a disability, we're going to give them some cash. No, we want to identify the particular needs that people have and be able to provide those. Scale up financing. Of course, throughout everything, ensure the meaningful participation of persons with disabilities. And finally, promote collaboration and coordination among governments, OPDs, civil society, development agencies, and the private sector to drive innovation, share best practices, and hold everyone accountable for disability inclusion. So I really urge you to look at the full report, because there's an awful lot of information there, guidance there, and references there for you to follow up on particular areas that may be of interest to you. And I'm happy to answer questions about the report, how it was done, how it was written, what's in it, etc. Thank you.
Thank you, Dan. And for those of you who want to get quick access to the report, if you look in the chat, there are links to the report and also to the Global Disability Summit commitments. And I think Elizabeth said that 86 of those are on data. which is nice to see, and some mention the Washington Group itself. We have a couple of minutes for questions. If you want to just unmute yourself and ask a question, go ahead and do that now, or you can put it in the chat. I can get access to it. So any questions?
Okay.
I have a quick question for both of you. You know, we said we've been doing this as the Washington Group for a while now. And in some ways, we feel like we've made great progress. We have all these tools, they're being used. There seems to be adoption, change in thinking about how to collect the data. But often when you go to meetings or all you hear is there's no data. So I kind of feel like I live in this kind of parallel universe where there's lots of data, but no data. Did you get a feeling from the summit about what kind of a major blockage is in kind of getting disability data to where other areas are? I know I'm throwing this question at you, but it's been bothering me. You know, where it kind of has the same kind of acceptance or standardization as like Employment Day or something. And what do people really want most help in, or what could the Washington Group or should the Washington Group do to kind of further this? If you had any thoughts, just jump in.
I think I'm really curious what Elizabeth says, but I think two things. One is the need to analyze and publish that data. It's one thing to have it on a survey and be sitting somewhere, and then people say there's no data because they haven't seen the report. They haven't seen that data published and analyzed. I think that's one reason people think it's not there. And the second is what I was saying about the lack of data on environment, the lack of data on what works for inclusion. So yes, we know that people with disabilities are less likely to be employed. Well, what's the data on the main reasons why they're not being employed? Where's that data? And we have the ILO Washington Group disability module has rarely been used, a few places. And so I think it's that next level of data, just beyond prevalence and SDG indicators, that needs that people are looking for.
Yeah, I absolutely agree with that. And I would add that what we hear a lot are lack of resources to collect disability data or to analyze it, and lack of political will. Absolutely. I think this is very, very important. And then as a priority, capacity strengthening is really what we get asked all the time. Can you help train us in this or help us do this? And also more and more important is this idea of intersectionality. So the different ways that disability intersects with other groups and the barriers, and that builds on what Dan was saying. Thank you.
And I think sometimes they're frustrated by the sample sizes aren't large enough to disaggregate by characteristics. Or we really want to know about women with intellectual disabilities and what's their situation. Well, oftentimes we don't have the samples sizes big enough to accurately look at that subpopulation. People get frustrated by that.
If you two and everyone else could think of ideas of where you think the Washington Group can best meet these needs, what should we be doing in the next year or 5 years or whatever it is, that could address some of these things, that would be very useful, because I think we are doing some tool creation, but not as much. And we started on this dissemination activity. Is that the right activity? What is best for us to do? Well, we're a minute late, which is pretty amazing. Thank you to all the presenters. And we're going to take a 4.5 minute break. We're going to start promptly at 9:40 my time. No idea what that is where you are, but please try to get back in 4 minutes or so. Thank you very much. Okay, that break went pretty quick. Sorry about that. We're going to move to our next session, which is a report from our mental health and psychological functioning work group, our mighty work group that's really been doing amazing work in this area. And the chairs of that are Elena De Palma and Margie Schneider. And Margie is going to be doing the presentation today. Margie, I'll hand it over to you.
Thank you very much, and for allowing Elena and I to do an update. So next slide. So the group was set up in at the 13th Washington Group annual meeting. And the objective and goal was to ensure adequate coverage of functioning difficulties arising from, and I need to correct this terminology, mental health conditions in the Washington Group functioning measures. So to make sure that people with psychosocial disability are captured when we collect any disability data. And we want to look at developing a minimum set of questions for population-based surveys that measure psychosocial functioning. Next slide. And so to go about this, we did an initial literature review to identify what were the most common domains linked to mental health conditions and which of these were already covered in the Washington Group existing sets and which were missing. Then we reviewed the survey tools for the questions addressing the missing domains and adapted those questions to fit the Washington Group format of the questions. We also developed a training course to train people to do cognitive testing interviews, to start working on seeing whether these questions work or not. And we've conducted 4 cognitive interviewing tests, 1 in South Africa in English, 1 in Costa Rica in Spanish, 1 in Hungary, in Hungarian, and in Kenya, which was a combination of English and Kiswahili. Next slide. So the 2 domains that weren't yet covered in the existing Washington Group sheets was interpersonal interactions and controlling behavior. And the others, self-care, communication, remembering and thinking, and mobility, were already all covered in the short set and extended set. So we developed a set of 7 questions, which you see here. It's about difficulty getting along with people who are close to you, dealing with people you do not know, making new friends, maintaining friendships, forming relationships with other people, controlling your emotions when you are around other people, or controlling your behavior when you are around other people, and using the same response options. All right, next slide. So in the 4 cognitive testing, we had 106 respondents in total. 62 of them were disclosed as having a diagnosed mental health condition, and 44 without a mental health condition. And you can see in the table the breakdown by country. And what we did in the analysis was firstly look at the patterns of interpretations. How did people understand the questions and interpret the meaning of the questions? And how did that lead to the response that they gave? And what we looked at were in-scope interpretations that met the requirements of what we intended by the question. And then the out-of-scope ones were ones that fell out of that intended meaning or interpretation. And then we also looked at the response that people gave and how that matched with the narrative that they gave, the reasons they gave for giving that answer. So looking at the congruency. We also looked at the number of respondents with a mental health condition that were identified by the psychosocial questions, as well as the affect questions in the extended set, the depression and anxiety questions, which we also asked. We didn't ask them to discuss the interpretations of those questions, but we just got responses on those questions. We also looked at whether people with a mental health condition had a typical response profile for these 7 questions that was different to the profile of responses for the people without a mental health condition. And then lastly, we also documented whether they had difficulty with the using the response options, whether they wanted repetition of the questions, those kind of difficulties. Next slide. So what we found is a majority of the interpretations were in scope. There were a few out of scope, but they were minimal. And there were a few interpretations that were quite narrow. So in forming relationships, for example, some people focused only on intimate relationships and not thinking more broadly about any relationship. So that's a slightly problematic interpretation. And the few out of scope interpretations are things that we want to carry over to the next round of cognitive tests to test out whether that's a broader out of scope interpretation or not. If you look at the people who said a lot of difficulty or cannot do, or were identified using the usual cutoff point, we find that the blue bars are the respondents with a mental health condition that reported a lot of difficulty or cannot do. And the orange bars are the people without a mental health condition that reported those difficulties. And you can see that by far the majority of people reporting difficulties were people with a mental health condition, with very few people without a mental health condition reporting difficulties. And forming relationships, dealing with people you don't know, making new friends, controlling emotions were the 4 questions that elicited the most responses of difficulties. Next slide. So when we looked at, are we able to include people with psychosocial disability into disability statistics by asking these questions? And so we looked at who was captured in or counted in by the affect questions only, by the psychosocial disability questions only, and by the affect plus psychosocial functioning questions. And you find that for people with a mental health condition, 81% were actually identified by one or both sets of those questions, and only 20% or 19% were actually missed. And we could look at reasons for that because we only interviewed people who were able to respond, who weren't in full-on severe symptoms. Without a mental health condition, we correctly excluded or didn't count 66% of the people. And you can see that a lot of the people who were counted in was because of the affect questions. And we know that those tend to elicit a lot of positive responses from a wide range of the population. Next slide. So having conducted these 4 tests, we now have revised the questions and we have 6 questions that are left. In fact, 5, and So that we keep, do you have difficulty getting along with people who are close to you, staying as is for further testing? The same for people you do not know, staying the same for further testing. Do you have difficulty making new friends? We are deleting the word new because that seemed to create problems. So it will be, do you have difficulty making friends? We are thinking of deleting the question, do you have difficulty maintaining friendships in everyday life? Maintaining friendships, as that seems to, there are lots of reasons for that aren't related to psychosocial functioning. And then in forming relationships, we are taking out the phrase in everyday life and just asking, do you have difficulty forming relationships with people? The word other people seem to create a lot of difficulty as well. And then lastly, we have combined controlling your emotions or behavior into one question, since for 95% of the respondents, those 2 were completely interlinked. And so these are the questions that will go forward for the next round of testing. Next slide. So in 2025, we've had discussions with a number of groups, CBM, an IDA with Transforming Communities for Inclusion group, which is an umbrella body for people with psychosocial disability. In Jordan, they've actually used some of these questions in their survey, and we're waiting to find out more about the results of that. The Brazzaville Francophone Regional Group are interested in just having further discussion, and there have been interest from a number of other countries, but it's always the difficulty of finding funding to be able to run cognitive testing. We've published one paper, it's in press, on including people with psychosocial disability in statistics, self-report measures for surveys in the African Journal of Disability, and that will be coming out very shortly. Beyond 2025, we really, really, really want to do more cognitive testing. So please come to the party, help us find funding or whatever is needed to conduct these interviews and also field testing. We are starting to work on a second publication, and we also want to draft a manual to support the implementation of the questions, as well as the analysis of and interpretation of the data coming from them. Next slide. So please contact us if you are interested and want to take the discussion further. Thank you very much.
Thank you so much, Margie and Elena. You've really pushed this work through force of will and have made great strides. And I know that there's a huge amount of interest on using these questions. It doesn't seem to be matched with people willing to fund the development of the questions, but what else is new in our world? But I think Elena and Margie have been very good at getting these tests off the ground with minimal funding and with a lot of support from them. So I encourage anyone interested in moving this forward to contact them or contact the Secretariat or whoever. Right now, contact me and we'll pass that information on. And again, if you're interested in having a longer discussion with Margie and Elena about these topics, we can certainly create a webinar for later in the year. And it would be really interesting to dig a little deeper into their data and why they're suggesting the changes that they're suggesting. Unless there's a burning question, I'm going to move to the next session, which are the updates from the Regional Disability Statistics Group. We have asked the chairs and co-chairs here to do the impossible and just to do all the reporting they need to do in 5 minutes. I'm not going to open it for questions after each one. We just don't have the time. We will, though, again, could have longer webinars on combinations of these or single, but if you have questions and you don't have somebody's email address, send it to me. I will make sure to get it to them. So we're going to move forward, and we're going to hear from the Brazzaville group, the South and East Africa group, the Buenos Aires group, the specific group, and also from UNESCO. So I am going to turn it over to my colleague, Yusufa, who is the Interim Director for Social and Demographic Statistics at the National Bureau of Statistics in Niger. Yusufa, floor is yours.
Thank you very much, Jennifer, dear colleagues. I will quickly like to talk during this session on behalf of the Brazzaville group. Even though I already have wanted to present it in French, but since the presentation is in English, I will go ahead. So quickly, I wanted to present our group, which is a group of 25 country members. The group have renewed his secretariat during his meeting of 2019, which held in Dakar, which set up a secretariat, the first secretariat. And during the meeting of October 2024, which held in Djibouti, our new secretariat have been set up, which is composed by the chair is Niger, the vice chair is Equatorial Guinea, the members are Cameroon and Senegal. The activities focus on promoting research on people living with disability, with a particular focus on comparable disability statistics, sharing knowledge and best practice between member countries on the collection and analysis of data, strengthening the capacity of National Statistics Bureau on the collection and analysis of data on disability, promoting the use of research results on disability for better inclusion of people. Upon setting up the secretariat, so we work quickly on a work plan for 2026 to 2027, which is equivalent to our term. And the first axis of this work plan is focused on improving data collection on disability. The objective here is to obtain reliable, disaggregate, and comparable data on people with disability, with a first action which include updating the list of focal points. Then we'll carry out a diagnostic study of the existing data, which means the survey, the census, or the database that we can use in producing reports, country national reports. We also have to train the new focal points on the tools, because this list have not been updated since 2019, and we really like to go on the training of the new focal points, encouraging inclusion of disability model in the surveys and censuses across our region, strengthen the operational capacity of the secretariat. And the second axis focus on improving data analysis and enhancement. The objective here is to produce analysis useful of public decision making and raising awareness. So for this, we have come to notice that our main data source for producing report is the harmonized survey on living condition of household, which is carried out almost throughout all countries in our region. So we wanted to participate to the conception of this survey in order way to put more variables during this on the questionnaire, organizing an annual workshop of the group, continue to support countries in producing reports. Now almost half of our country members have reports. We wanted to go beyond and see how we'll come up with all the countries producing national reports. Organize a workshop to produce a regional disability report, as the first one have been done during our meeting in Djibouti. We really want to go and produce another regional report between 2026 and 2027. Organize a workshop to produce, to create an interactive online database accessible to public. We really want to go through this data dissemination to see how even those who are not participating to our meetings can go and use the data we are publishing. So for the third axis of our work plan is going toward disseminating data and increasing the use. So this will be done through the participation into the Global Disability Summit, where we can talk and tell the stakeholders what we are doing, what are the data that are available, organizing a meeting between our group and the African Federation with people with disability, involve people with disability in the development of indicators, because we have come to notice that these associations, they have some needs and they really want to come with we statisticians to see how we can produce data that can be used in monitoring and evaluation of their actions, including a model of on disability statistics in the training of demographers and statisticians across the region, which will be done through our institution, which are IFOD, NCEA, and the rest. And finally, at the end of our term will surely go on the renewal of the Secretariat. So this is really the main actions that we are focusing on during our time. Thank you very much, and I'm very grateful to present our group, and will be very happy to answer to your question. Thank you.
Thank you so much, Yusufa. I is always amazed as how active the Brazzaville group has been, now under 2 leaderships, and I believe your group gets the prize for the most reports submitted in the project. We'll figure out what that prize is very soon and send it on to you. But thank you very much, and it's been a pleasure. I am going to quickly move to our next presenter, Neud, from the Gender and Marginalization Groups in Statistics South Africa, where she's the director. And I'm going to hand it over to you, Neo. Just let me know when you want me to switch the slides.
Okay, thank you very much, Jennifer. Good day, everyone in the meeting. Okay, I thought maybe it will be best to start with the regional group objectives. The main objectives for the regional group was to develop and improve disability data and related statistics in the Southern and Eastern African region for the English-speaking countries. We wanted to ensure that we advocate for the use of the Washington Group data collection instruments, build capacity of the regions through conducting training on Washington Group data collection instruments, training on data analysis and dissemination, reviewing the Washington Group data collection tools with the aim of incorporating issues that are pertinent to Africa, ensure cross-national comparability of disability data and related statistics. Yes, you can move on to the next one. And build technical expertise within the regional group. Yes, next slide, please.
Is this
Is
the
it
one you
moving?
want?
Sorry?
Do you want this slide, progress to date?
Yes. Okay, when it comes to the progress to date, the regional group was inaugurated in July 2022. It was a virtual meeting, which was facilitated by the Washington Group Secretariat. And since then, we've had 3 in-person training meetings in South Africa, Kenya, and Malawi, and several webinars online. We are always having a continuous uptake of Washington Group short set in surveys among the countries. We encourage that, and we've received technical support to countries from the Secretariat in the analysis of Washington Group questions. We've continuous submission of the annual country reporting templates to the Secretariat, and we've also had a few countries that contributed to the standardized country reports with the technical support from the Secretariat, just to mention a few like Kenya, Zimbabwe, and South Africa. Yes. Next slide, please. So what are the plans going forward? Going forward, we understand that we need to collaborate on a regular basis as a regional group. We believe that there has to be monthly online meetings. Ideally, we should have physical meetings at least 2 times a year. We need to document best practices, share of the calendar of events, and sharing the Washington Group implementation and country challenges. Yes. And with regards to building the statistical capacity of the countries, we thought it will be ideal to promote the inclusion of standard disability measures into the national statistics systems, national statistical survey systems. And we also need to ensure that we promote the analysis and dissemination of disability reports and build and maintain the regional technical expertise, and that we will be able to support the regional activities. And we also want to encourage inter-country study tours. Then the other issue that we thought that needs to be prioritized is on sustainable funding, where we need to look at alternative funding to complement the existing funding, to sustain our work program, to fund the activities of the regional technical expertise, to provide technical support to countries, and to support physical meetings and capacity building programs. Yes. I think that is about it. I think the next slide is blank. Yes, thank you very much.
Thank you so much, Neo. I should say that South Africa and Kenya co-chair the Southeast group, and as the Brazzaville group has a very ambitious plan going forward. I think there's, we obviously will see similarities across the working group activities, but the one, of course, that stands out is funding. And again, any ideas about that? Any connections anyone has anywhere? The Secretariat is willing to pursue leads. The problem is we are not in a position where we have a lot of leads. So, of course, for all of the regional groups, the Secretariat will continue to support as we can, but certainly this all works better when people meet more often and meet in person. And that's obviously what we would like to do going forward. But thank you, Neo, for the presentation and for all the work that you have done over the past several years. Okay, we're now going to move to the Buenos Aires group. Rita, Deputy Director of Conceptual Process Standards at the National Institute of Statistics and Geography in Mexico. I'm going to hand it over to you.
Buenos días, mi presentación va a ser en español, aunque las diapositivas se encuentran en inglés. Sí, antes que nada, pues agradecer 25 años del trabajo del grupo, no es fácil decirlo, realmente ha sido un trabajo que ha roto muchos paradigmas en cuanto a las personas con discapacidad. México asume en 2025 la responsabilidad de coordinar este grupo, pero desde 2019 Argentina, con una gran voluntad, arrancó este grupo regional. Por situaciones propias del país, pues en 2024 a fines anunciaron que ya no podían coordinarlo y México junto con Brasil asumen seguir manteniendo el funcionamiento del grupo. ¿Qué es lo que se ha hecho? Se actualizaron los términos de referencia del grupo a partir de buscar darle mayores elementos de soporte a estos términos de referencia. También se identificaron a los puntos focales de los países. Logramos concentrar 17 países de la región de habla hispana y portuguesa. Estos aquí se encuentran listados. Y empezamos a hacer capacitación primero de las herramientas. Hay muchos cambios dentro de cada uno de los institutos de estadística. Entonces, esto nos llevó a retomar nuevamente el que los países conocieran las herramientas desarrolladas por el grupo. Entonces, tuvo una sesión durante este año más técnica de presentarles las herramientas y sus alcances. Y a partir de ello definimos líneas de acción. Si me dan la siguiente diapositiva, por favor. The next. Ok, las líneas que hemos definido como grupo para empezar a trabajar durante 2025 y 2026 y posiblemente 2027 es una, primero, apoyar en todas las solicitudes que hace el grupo de Washington en relación a los reportes país. Vemos que cada región tiene entre 3 y 4 reportes con lo que presentó Jennifer. Pues vamos a impulsar más, que más países puedan reportar. Una de las limitaciones es todo el retraso que se tuvo de la ronda Censal 2020 debido a la pandemia. Entonces esperemos que ya la mayoría de los países de la región ya están terminando sus rondas censales y utilizar esta información para el reporte país. La otra es evaluar, y ahora con lo que presentó Margaret sobre el test cognitivo, evaluar la posible participación de algunos países en esta nueva versión de preguntas de este test. Otra de las líneas de trabajo es poder desarrollar el capital humano a partir de que uno es la aplicación de de las diferentes herramientas del grupo. La otra, avanzar en la gobernanza de los datos. ¿A qué nos referimos con esto? Que realmente tengan un uso adecuado dentro de cada país para la toma de decisiones, que sepan los países o las partes técnicas de los países cómo procesarlos, cómo analizarlos, la validación de los mismos dentro de sus fuentes de información y también preparar materiales para divulgar. Sí, ayudarlos en términos de cómo producir las propias tabulaciones que se publican, si utilizamos a toda la población, si utilizamos a la población de 5 años y más, sí, cómo hacer los cruces para que sean válidos, esto de la representatividad de los datos que hablaba Daniels, para que los países puedan hacer un mayor uso y difusión de lo que obtienen de utilizar las preguntas del set corto del grupo de Washington. Hay una idea, es una idea que es hacer un reporte regional basado en la ronda censal 2020 y a partir de ahí poder... hay un micrófono por ahí abierto.
Go ahead, you can go ahead. Rita, I think we fixed it. Oops.
Listo. La otra es poder tener un informe regional basado en la ronda censal y buscar estandarizar como este reporte a partir también de la propia estandarización que está haciendo el grupo de Washington para las estructuras por sexo y edad. O sea, utilizar la misma metodología para mantenernos comparables a nivel interno y a nivel internacional. Y buscar estrategias, estamos en las mismas condiciones, buscar estrategias con otras organizaciones para el apoyo a los trabajos del grupo. Ahorita estamos definiendo lo que, cómo poder hacer estas estrategias. Estamos tomando en cuenta la nota que ustedes enviaron a los coordinadores para ver las posibilidades de buscar estos apoyos de financiamiento para los trabajos propios del grupo y del grupo de Washington. La que sigue, por favor, de Next. Como podrán darse cuenta, en esta presentación ya logramos definir un logotipo propio para el grupo de Buenos Aires, que queremos tomar ya como una identidad hacia las distintas regiones. La idea es que podamos tener mucho más empuje a nivel regional y hemos realizado 3 reuniones bueno, 2 reuniones durante este año. La siguiente es la semana que viene, en este próximo miércoles, el 5 de noviembre, tenemos nuestra reunión de cierre de este año y ya poder definir a los países coordinadores de estas líneas de trabajo que presenté anteriormente para que hagan sus propios programas de trabajo y vayamos dando seguimiento. Pues muchas gracias. Esperemos seguir colaborando con fuerza a los trabajos del Grupo de Washington. Gracias.
Thank you so much. And I love your logo, and you get the prize for the first group logo, and all the other groups better take note. I think we expect to see logos coming in. Thank you, Mexico and Brazil, for agreeing to take on the Buenos Aires group, and you also have been quite busy and happy to continue working and furthering your goals. I am now going to turn it over to the Pacific group, to Elsie, who is the statistics analyst for gender equality, disability, and social inclusion, statistics for development with the Pacific community. Elsie, floor is yours.
Thank you so much. Good morning, everyone. So I'm very happy to present on behalf of the Pacific Group on Disability Statistics. The Samoa Bureau of Statistics is the chair of this group, and the Pacific community is the secretariat of the group. So next slide, please. So just to give a little context of our group. So the PGDS work to strengthen disability data across the Pacific region, guided by a vision of an inclusive and better evidence for decision-making. So our goal is to ensure timely and relevant statistics that support social inclusion and policy planning. Next, please. Over the past year, we've made significant progress across the Pacific country. So far, we have 17 out of 22 countries which adopted the Washington Group's short set of questions in at least one census or household survey. And 6 countries have published a disability report, and a regional dashboard is developed in our SBC Pacific Data Hub. So in this Data Hub, we host the Pacific Disability Country Data and Indicator. Next, please. So in 2025, one of our key milestones is the development of a regional guidebook on disability statistics to strengthen disability data collection, analysis, and use. And alongside this, we are creating currently a statistical toolkit, including a country report template to support Pacific countries in producing their own report and analysis. So those resources will be officially launched next week during our regional head of statistics office meeting. So I think that after that, we can officially share all this with you. So during this year, we've also released some key products, including a country disability report, for example, for Kiribati, Tuvalu, and Solomon Island ongoing. We also developed additional statistical products, like a disability fact sheet, just a 2-pager summary from the big report. And to make our data more inclusive, we also developed an easy read version of this big report to allow our data to reach out more people possible, especially people with disabilities. And as Elizabeth said earlier during this meeting, This year, some PGDS members, including me, participated in the Global Disability Summit. And in terms of capacity building, we have also held a regional workshop in Fiji. And we also engaged in a policy dialogue with organizations of persons with disability. So we can go for the next slide, please. Looking ahead to 2026 and 2027, plans include in-country data analysis and interpretation workshop. So the idea is when we are going to develop a disability report for a country, we will be organizing in the country with different stakeholders a data analysis workshop to ensure that all the stakeholders are engaged on the country data analysis. And so from that, they can properly use the data for policy brief or policy inclusion. And so we think that we are not going to be too ambitious this year because we know that we have a lot of different constraints, but we would like to develop a country report for at least 3 countries next year. And we also want to organize a regional training and the implementation of the regional guidebook. And additionally, in 2027, we aim to develop and launch a Pacific Regional Disability Monograph that brings together data from several countries as possible and providing a comprehensive regional perspective on disability statistics. So I'd like to precise that on the regional guidebook, we've developed a list of key indicators that we would like to have those indicators calculated for each country using the census or household survey. And we do this to harmonize all the different indicators that countries developed in the previous disability report. So in summary, I can say that the Pacific Group on Disability Statistics is making small progress toward inclusive development by improving disability data across the Pacific region. While we've achieved important goals, there is still significant work ahead. So strengthening country capacity, ensuring consistent data use, and completing regional products will require continued collaboration and resources. So thank you very much for your attention, and over to you, Jennifer.
Thank you so much, Elsie. And I would say you've done more than make a little bit of progress. You've made a huge amount of progress. It's very impressive. And I've seen the guidebook and it is very impressive. So congratulations to you. I know you and a couple of other members are joining this meeting at around 2 o'clock in the morning, and kudos to you. And thank you very much for that.
Thank you so much.
It shows your commitment, and it's quite impressive, as is the work that you've been doing in the Pacific area, and we value that collaboration very, very much. So our last presenter here is Mustafa from, the head of the Statistical Policies and Coordination Unit, Statistics, Information Society, and Technology Cluster at UNESCO. And is another region which has done a huge amount of work, including guidebooks and regional reports, and it's been quite impressive. So I'm going to turn it over to you, Mustafa. And I know we're running a little late. We will ask you to stay an extra 5 minutes past the end time so we can do the close up, which I will do very quickly. But you go ahead, Mustafa.
Hello, good morning, good evening, good afternoon for everybody. I know that it is really a problem for having this under this pressure, but at least I will go through my presentation very quickly. Jennifer, you can speed up with me just to express my pleasure to represent my organization on ESQA on what we are working on disability. Actually, what ESQA is doing is working closely with the member states, and we used to focus on the capacity building in line with Washington Group principles and guidelines. And it is worth to mention, Jennifer, that over the last years, we are working closely together, and also the great opportunity and the success story of what we did last year on how we transform our work from the idea of having a regional workshop on Washington Group principles to in national fora, how we can harmonize the definitions and the questionnaires, and how we can invest in the civil or admin data on the disability statistics. And this will be the first time in our region that we are going to implement in cooperation with Washington Group and UNICEF, with other partners in the region also, for the national entities who are in charge and or working for the persons with disability in United Arab Emirates. It will be, I think, a model that we are expecting expanding such model in the region. Next, please. The idea of having these workshops over the last few years, you can just see that we used to have a continuous work. It's vary from year to another, but still keeping the process working in order just to keep our efforts so close to our member states and to enhance their capacities from one side, and from the other side, how we can encourage them to implement or to embed the Washington Group, at least with the short model, within the running surveys once they haven't enough resources, as everyone is suffering from such issue. So this is how we are working. To complement our work, we are trying to also to introduce the guidance for the national report for the machineries working for the persons with disabilities, in cooperation with the statistical offices, in order to provide them with the data based on the Washington Group guidance. And we had last year in Oman, Muscat, part of the presentation that's been presented by Washington Group colleagues to this to this workshop on this. Next, please. We used to document all of what we are working to transfer the knowledge by not only the reports and the guidance, but also to distribute and to submit it on our website to be accessible easily for our member states and all partners in the region. Of course, we have a problem with having the translation to Arabic in many cases, and even the global report that now being released, just released from UNSD, we are trying to find out how we can translate it to Arabic, and this is one of the challenges for us also in our region, because it will make different to have the local language for them. Next one, please. To finish with the last minute, not to exceed my time, we developed the glossary for the disability statistical terms and also the database. By this, Jennifer and colleagues, I will stop here, but just to say you words that ESQA in the region work closely with the country, with our member states, in order to enhance the mentality of producing the data, not any data, but based on Washington Group guidance in linkage with what they are producing during their normal work with their national entities. Thank you very much.
Thank you so much, Mustafa. And I'm sorry if you felt, rushed. I thank all the speakers. I know it was unfair of us to ask you to speak so quickly, but there was so much interest in what you were doing, and we couldn't pick among you. So I will say that in the ESQA region, we have always used your guidebook and your data report as examples of how it should be done and what others can do. We send it out a lot, and now we'll have similar guidance from the Pacific. We should kind of take a look and compare the two at some point. I am very, very quickly going to go through session 7, which is the accomplishments and next steps. I'm not going to talk about the accomplishments. We've really covered a lot in the last couple of hours. The full set of the slides are in the chat, so you can download them. And the recording will be made available a couple of weeks after the U.S. government opens. So I am no longer making predictions about when that will happen. But I want to thank everyone who presented today, kept on time, you were interesting, and it was exactly what we wanted in this very short time period. And actually, a lot has happened over the last year. Kind of looking ahead, we would like to get more reports, and we would like you countries out there that you have emails from me that I need something from you, please respond. I don't want to inundate you with requests, but you guys know me well enough that I will. So just answer me and then I will leave you alone. Get in touch with Margie and Elena about testing. It would be wonderful to finalize this, but it's a very sensitive area, and we want to make sure that what we put forward is well tested in a lot of regions, and so everyone can be very comfortable with the data. And again, the translations work group, we're going to have to get started again so that we can move on translations and making them more available to a wider public with more information. Okay, looking ahead, maybe we'll have another meeting in the spring. I don't know. I don't want to promise. We'll see. But I think we can have a set of webinars over the year. We did not do that last year, even though we intended, and that was because of the constraints that the Secretariat was operating under. But I think we'll be able to get around those and restart those. So we want to figure out what we should be doing. In the past, there have been the topics of interest that have come up, or the history of the Washington Group. That's an easy one. So if you would like that one, we can do it. Another one was that we started at the WG24 were sources of variation in disability prevalence. I think that was the top one that people wanted to talk about. If you're still interested in that, we can certainly do it. And we have called on Dan to help us. And now this meeting, what I heard a lot of was the use of administrative data. You know, surveys are overburdened and underreported in terms of response rates everywhere. We're probably not going to get a huge much more out of surveys. A lot of countries are moving to administrative data. We have talked about this in the past. We had a working group that kind of dissolved. It's a source of data, but there are a lot of caveats, But if there's interest in having a webinar on this, we certainly can do it. We have a lot of material that we can start with. So I see where I would start if we were going to do webinars would be something on administrative data and something on sources of variation. Put it in the chat if you can now. If not, send me an email about what you would like to have a webinar on. We will start scheduling them again as soon as the government opens, but we probably between now and next year, maybe now in summer, we could do 1 or 2. We would need help from you, especially those of you who have either expertise in the area or burning questions in the area, because that helps us do the planning for that webinar. So please send in your thoughts about this. Doesn't have to be a long email, very quick. I feel much better when I get emails. I know we're doing the things you want us to do. So please get in touch. And we will be doing our normal secretariat reporting. We just sent in the Washington group part to the Statistical Commission meeting because this was our year to report. We'll make that available. We will continue to do as much technical assistance as we are asked to do. We will continue to support the wonderful regional groups that you heard about who are just all doing a lot, moving forward and have great plans. We will continue to provide technical assistance on anything having to do with the data that Washington Group has developed that you have questions on. We're really happy to do it. Please feel free to email the Secretariat, email me at this point personally, because I won't get it from the Secretariat box. Feedback and questions on today's meeting content, ideas about work plans, webinar topics, and any submissions of news and events, new releases, reports, uses of the tools, other accomplishments, we will put it on the website. So please send us stuff. So the Secretariat email is here, but send it to my private email. I think all of you have it. It's jhmaddens@gmail.com. I mentioned earlier that there were some of our partners are looking to get support for improving disability statistics in general. They have partnered with the Washington Group. Very early days. We have no idea if there's going to be money. The money, though, will be a different kind of funding than we're used to, but it will still support us and may support some of our regional groups, may even support some countries. So you might hear about that. We might send some emails out, but I don't know where that's going to lead. It would be great if it happened. We'll continue to be on the lookout for other funding, but I don't have anything in hand, so I can't say what that would be. I don't want to take any more of your time. We're running a little late. I want to thank you all for coming and celebrating our 25th anniversary meeting. Happy 25th, everybody. Thanks again to the steering committee, the planning committee, the work group chairs and members, the regional group chairs and members, all of our partners, our colleagues at UCL who have been so wonderful in supporting us these past years. Thank you to the membership. It has truly been a pleasure to work with you over these past 25 years of meetings. And we do want to make sure that the Washington Group stays relevant. If we're no longer relevant, then we don't have to exist. So coming back to the question I asked Dan and Elizabeth about what needs to be done to move this forward, if you have ideas about that, or you want to support some of the things they suggested, figure out how the Washington Group could do it. What can we do in terms of dissemination? What can we do with reporting? What can we do in technical assistance? What is our role? I will bring this to the steering committee to talk about and develop. If you have ideas and you want to be a part of that conversation, let me know. Email the Secretariat box, email me. Use both right now until we get back to normal. Thank you again to Kalama for all the wonderful support you've provided. We could not have had this meeting without you because we had no other way of running it. But without your wonderful interpretation services, we would not be able to accomplish what we do. So thank you very much, and for all the partnership. And everyone, have a good day. And for those of you who want to go to bed now, please do. And thank you very much. Bye.
Thank you.
Thank you,
Bye.
Jennifer, for all of your work. and for keeping us going.
It's been my pleasure, and I'm sorry I'm coughing. It's allergy season.
We really appreciate all the work that you've put in, particularly with all the difficulty that's happening with the rest of the Secretariat at the moment. So thank you for everything that you're doing to keep us all going, keep us on track.
You are very welcome.